Princess Caro Caro. I am Mariel Junti Arsenio, a grade 11 student at San Pedro College of Business Administration, and in this video, I will demonstrate the right and proper way of performing CPR. But before we start, let me first define what is CPR. CPR stands for Cardiopulmonary Resuscitation, is an emergency life-saving procedure that combines chest compression, often with artificial ventilation, in an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in a person who is in cardiac arrest. It is recommended for those who are unresponsive with no breathing or abnormal breathing. CPR is unlikely to restart the heart. Its main purpose is to restore partial flow of oxygenated blood to the brain and heart. Its objective is to delay tissue death and to extend the brief window of opportunity for a successful resuscitation without permanent brain damage. When a person suffers from cardiac arrest, the blood will not circulate and the heart stops to function. They stop breathing and lose consciousness. Without oxygen being cast from the lungs to the bloodstream and then pumped around the body by the heart, the person will suffer irreparable brain and other organ damage, or worse, that person might die within just a couple of minutes. To avoid such a situation, one must be given immediate first aid attention, which is CPR, that can literally save someone's life in such situations if performed correctly.
But before commencing CPR, the following basic life support techniques must always be followed. For the first step, check the scene and the person to make sure that there is no further danger to the victim and the rescuer itself. Make sure that the scene is safe. Then, check for the patient's response. Try to wake him or her up by tapping the person on the shoulder and shout, "Are you okay?" or "Can you hear me?" to ensure that the person needs help. Second, if that person is not breathing normally, immediately call 911 or the emergency local hotline of the Philippine Red Cross, which is 143, for assistance. If it's evident that the person needs help, call or ask a bystander to call 911, then send someone to get an AED. If an AED isn't available or there is no bystander to access it, stay with the victim, call 911, and begin administering assistance. Then, the next step is to open the airway. With the person lying on his or her back, tilt the head back slightly to lift the chin. Then, the fourth step is to check for breathing. First, position your head 2 inches away from the patient's mouth. Listen carefully for no more than 10 seconds for sounds of breathing, but if there is no signs of breathing, commence CPR immediately. And here are the following steps to perform CPR correctly. First, visualize the center of the patient's chest and place the heel of your palm. On that point, place the other palm on the top of the first and interlock the fingers alternately. After that, you can now perform CPR. Remember to push hard and push fast. Use your body weight to help you administer compressions that are at least 2 inches deep and delivered at a rate of at least 100 compressions per minute. But according to the Philippine Red Cross, it must be at least 1 cycle of 30 compressions and 2 ventilations. After 30 chest compressions, the second step is to deliver 2 rescue breaths. With the person's head tilted back slightly and the chin lifted, pinch the nose, then shut and place your mouth over the person's mouth to make a complete seal. Blow into the person's mouth to make the chest rise. Deliver 2 rescue breaths, then continue compressions. Lastly, continue CPR steps. Keep performing 5 cycles of chest compressions and breathing for 2 minutes until the person exhibits signs of life, such as breathing. Remember that you cannot hurt the patient by giving unneeded CPR, but if the patient needs CPR and you don't do it, the patient might die. Then after 2 minutes of performing CPR, check again if the person has gained consciousness or has signs of life. But if there is still no breathing for 10 seconds, repeat the CPR. If the patient or the person exhibits signs of life such as breathing, you can already stop performing CPR. You can also stop if an AED becomes available, an EMS or a trained medical responder arrives on scene. If the scene becomes unsafe for you and you cannot continue performing CPR due to exhaustion, you must end the cycles immediately. There is also a different way to perform CPR on a newborn baby. Before performing CPR, you must ask for the parent's consent and remember that great care should be taken when performing CPR on an infant. Although a babies born are more flexible, they are also much more delicate. First, check the scene and the child. Make sure that the scene is safe. Remember that you must not shake the baby. Instead, stimulate and tap or flick the soles of an infant's feet. You can also tickle his or her hands to see if there's a reaction. Second, if the baby is not breathing normally, immediately call 911 or the emergency local hotline of the Philippine Red Cross, which is 143 for assistance. Of course, if there's another person at the scene, ask them to call. Next step is to check for breathing or signs of life by doing the LLF position or the look, listen, and feel position. First, position your head 2 inches away from the baby's nose and mouth. Listen carefully for no more than 10 seconds for sounds of breathing. But if there's no signs of breathing, commence CPR immediately.
1006, 1007, 1008, 1009, 1010.
When providing chest compressions, use only 2 fingers at the center of the baby's chest while your other hand is supporting the baby's head. Compressions should be about 1.5 inches deep at a rate of 30 compressions to 2 rescue breaths. While performing chest compressions, we must look at the baby's face to see if there's a reaction. After 30 compressions, deliver 2 rescue breaths by slightly tilting the head and must be in neutral position. Then, do the mouth-to-nose ventilation while giving 2 rescue breaths. Then, keep performing 5 cycles of chest compressions and breathing for 2 minutes until the baby exhibits signs of life such as breathing. To avoid complications, only enough air should be given to the baby after one cycle. Simply repeat up to 5 cycles of chest compressions and 2 rescue breaths within 2 minutes. After 2 minutes, observe the baby. If it still has no signs of life or breathing, continue performing CPR. If the baby or the infant exhibits signs of life such as breathing, you can already stop performing CPR. You can also stop if an AED becomes available. An EMS or a trained medical responder arrives on scene. If the scene becomes unsafe for you and the infant, or you cannot continue performing CPR due to exhaustion, you must end the cycles immediately.
That's the end of this video. Again, I am Mariel Jun P. Arsenio and thank you so much for listening.